So good morning to everyone, both in person and those who are participating online. It's good to see everyone in person, for those of you who are here, and I hope to speak to you all throughout the day. So it's great to be back. For the first session, as Louise just outlined, we have presenters from across the region focusing on the experience of planetary health in Asia. And I would just like to briefly introduce each of the speakers. You can see their full bios in the online program. So each speaker will have about 15 minutes to share their perspectives. Our first speaker is Mr. Arizman, who's Assistant Professor in the Department of Development Economics at UIN Jakarta, and Executive Director of the NTS Network Member Center for Southeast Asian Studies, Indonesia. Our second speaker is Dr. Toshi Manabe, Associate Professor, Nagoya City University Graduate School of Medical Science and Vice Director of Clinical Research Center at the same university in Japan. Third speaker is Major General Dipankar Banerjee, who's President of Chanakya Chakra in India. And our fourth speaker is Dr. Sufia Kanom, who's Senior Research Fellow at the Bangladesh Institute of International and Strategic Studies. Unfortunately, one of our speakers listed in the program is unable to be with us today, Ms. Nimi Jaya Thilake from the Network Member Regional Center for Strategic Studies in Sri Lanka, and she sends her apologies. So without further ado, I would like to give the floor to Mr. Arizman, please. The floor is yours.
Okay, thank you, Alistair. Can you hear my?
Yes, we can hear you.
Okay.
And see your PPT.
Okay, good. Thank you to all the participants of this conference, especially Prof. Melly, for inviting me, and I also impressed with the presentation from the Tan Sri Jamilah Mahmud regarding the planetary health. I would like to share one of the issue of this topic in Indonesia, medical waste and river pollution in Indonesia. Why I choose this topic? This is related to COVID-19 situation. Just a second. Okay. Yeah. Planetary health considered is a health comprehensively mental, social, and physical, and linked to human health with environmental health, already mentioned by Tan Sri Jamilah, people health, and also the planet health, through the whole system of framing, recognizing that urban population health intimately tied to urban social ecological system. I would like to touch about informal settlement intersect with the planetary health in several ways. Their vulnerability to flooding and climate change risks, such as rising sea level and more extreme weather, even exacerbated existing health inequities such as contamination of waterways and ecosystem. And Indonesia itself already recognized that water pollution, especially in the river, is very serious problem. A lot of regulation already established, but still based on the several studies by University Research Center and as well as Ministry of Environment, found that still many rivers in Indonesia, around 35, tested still unsafe source for drinking water. Based on the data from our Ministry of Environment, during the pandemic COVID-19, there's an increasing of medical waste. This is also Indonesia have a limitation of capacity for treatment facility for the medical waste. So this is increasing around 30% during the pandemic. And if compared to the facilities like hospital, health center, clinic, and other facilities such as laboratory, pharmacy, predicted that medical waste produced by Indonesia per day is 249 tons. In other words, is a deficit 70 tons per day compared to the facilities. So this is, we are talking about the facilities of treatment of medical waste in Indonesia. When we discuss about the linkage between environment and health, I try to refer to the model by Matthew, the planetary health model of health and environment in urban informal settlement. The first one, the physical or built environment drivers, which is urbanization, population growth, land generation, and building regulation. And then the second one is a social, social driver is a governance, both macroeconomic change, gender and social relation, and culture and behavioral norms. The third one is environment and ecology. The driver already mentioned, climate change, sea level rise, and biodiversity loss. And then the last one is human health, which is now we facing the COVID-19 pandemic and also related to the health policy in each country. Yeah, I just want to refer to this report, Asian Economic Bank report on medical waste management during COVID-19 pandemic in the capital of Southeast Asian countries. If you look at the data, there's an increasing of number of medical waste before the COVID-19 and during the COVID-19, especially in this big city like Manila, Jakarta, Bangkok, Hanoi, and Kuala Lumpur. So this has become a serious problem for ASEAN countries. For Indonesia itself, based on the data, I get that increasing of medical waste in February 2021, and then also increasing significant the amount of waste by 25%. The type of medical waste consists of disposal of PPE, personal protective equipment, which is including the face shield and mask, not only the medical waste from the hospital, but also the one who are doing self-isolation in the house or in the hotel. So the mishandling of medical waste in various places in Asia, of course, endangers our Indonesian environment, and of course also impact to potential disease to the society. This is need more improvement of medical waste management, so related to regulation, policy, as well as the awareness. Because this also found in several rivers in Indonesia, the medical waste throw away in the river. The leakage not only because of the liquid capacity, but also because of the moral hazard. Unfortunately, this kind of activities entering the water river and also the impact to the society along the river. So in addition to solve this critical problem, of course, there's some program already carried out by Indonesian government, but still lack of facilities and need more education to the community. I would like to share this one of the case in Cisadane River, which is Cisadane River is one of important river in Indonesia. Beyond the harmful environmental impact, the pollution has also potential effect on the health of millions of local residents depend on river cooking, bathing, cleaning, and even washing the clothes, and local children as well as to playing and swimming. So this is also one of the important river because provide 80% of water supply for citizens in West Java, Banten, and part of Jakarta. Data from Indonesian Institute of Science try to clarify to the same data with the Ministry of Environment that the increasing of medical waste during COVID-19 pandemic, not only from the hospital or healthcare facilities, but also from the hotels. This is related to the self-isolation in the hotel. And then we don't have improper processes of the medical waste. So this is also impact to the scavengers or informal sectors, which is not only for the environment, but also for the scavenger or informal sectors who collect the waste. There's a potential of high risk of disease spread among the scavengers. So the conclusion is for the medical waste treatment in Indonesia, of course, not only for human health, but this is also related to the impact to environment because they throw into the river and then the river getting polluted. And the most dangerous hospital waste is an infectious medical waste. And yeah, I mentioned about the gap between the medical waste treatment capacity. This should be a momentum for Indonesia to improve the capacity and also develop what kind of technology for medical waste management, not as incineration technology, but maybe the other alternative, especially this COVID-19 for the hazardous and toxic waste management system in Indonesia. So I would like to close my presentation, refer to Tan Sri Jamila that we don't have a planet A. We only have a planet A. We don't have planet B. So this COVID-19 teach us so many things and how the linkage between health and environment is important. And I also agree that the model by Cat Rewett, donut economic, can be one of reference to look at more holistic way to solve the problem in the current situation. I think that's all my presentation. Look forward to our discussion. Thank you.
Thank you very much. Please, can I now turn to Dr. Toshi Manabe, please, to deliver your presentation. And we will follow it all with an interactive Q&A at the end.
Okay, first of all, I'd like to take the opportunity to express my sincere appreciation for participating in this conference today. I'm Toshi Manabe from the Institute for Asian Human Community of Waseda University, Tokyo, Japan, and Nagoya City University Graduate School of Medical Science. Today, I'm going to talk about factors influencing to infection and severity of COVID-19 from the comprehensive perceptions. The purpose of my presentation is to discuss about the causes of different number of cases and deaths of COVID-19 depends on the different locations. Emerging infectious diseases are commonly defined as outbreaks of previously unknown diseases. The word pandemic means that an epidemic occurring on the scale that crosses international boundaries, affecting people on a worldwide scale. It can be said that the human history has been with the pandemic of emerging infectious diseases. Back in the 14th century, pest pandemic occurred in Europe that affected the deaths of 25 million people. In the 20th century, there are 3 influenza pandemics have been occurred, including Spanish influenza in 1918, affected over 40 million deaths. At the first pandemic of the 21st century, influenza H1N1 PDM09 pandemic has been occurred from Mexico. Then after 10 years, COVID-19 have been occurred in 2019. Even if it's not a pandemic, the emerging infectious diseases have been occurred in the sporadic area and time, including SARS, MERS, and avian influenza. Thus, the pandemic emerging infectious diseases will be occurred in the future. However, we would never know what kind of emerging infectious diseases will be happened. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, was detected as a causative agent of COVID-19 in January 7th of 2020. The researchers estimated there are at least 3,200 coronavirus that infected bats. Moreover, there are over 1,400 species of bats. So bats are incredibly various and successful creators. The fact that SARS-CoV-2 was first detected in Wuhan, China, that is far from the place where the kind of bats with the origin of the virus lived. Therefore, we need to have the linkage animal. As a linkage animal, the pangolin have been considered because sick pangolin has been found in Wuhan as a result of coronavirus infection. In addition, at that moment of the new coronavirus has been first reported in China, it was the season of the Lunar New Year holiday. Some Chinese had a custom to eat pangolin in such a special occasion. However, all of these issues have not been confirmed and only speculations. We still do not confirm what the intermediate animal of SARS-CoV-2 between bats and humans. Anyway, since the discovery of Wuhan, China, COVID-19 have spread rapidly to worldwide. These maps show the global transmission of COVID-19 in the first 1 month from the first report from Wuhan. In the first 1 month, 19 countries have been reported COVID-19 other than the mainland of China, with 2,826 confirmed cases, including 213 deaths. Among them, 12 countries are territories by Western Pacific or Southeast Asia regions of WHO, which is close area to China. However, the first imported cases was reported from Thailand in January 13, followed by Japan in January 15th, even though these countries are not attached with the land of China, but many travelers between the countries. These results suggested that the geographical distance from the origin of the infection is affected the spread of infection. It may be also affected the amount of human movements. 2 years later, currently 479 million confirmed cases have been reported globally, including 6 million deaths from over 220 countries and regions. However, 58% of total cases considered with the top 10 countries, with the highest number of cases. It means that the number of cases and deaths have a lot of difference between the countries and regions. So as a first question, why is the number of COVID-19 cases is so different depending on the country and region? Next, I would like to talk about the situation of COVID-19 in Japan. As of the end of March 2020, over 2.3 million cases have reported in Japan in 6 epidemic waves. We had the biggest outbreak since January 2022 due to Omicron strain. This slide shows that the change of the number of COVID-19 cases by the prefectures over time. There are 47 prefectures in Japan. Among them, Tokyo, Osaka, and Kanagawa prefectures are presenting the highest number of cases in each wave. Each wave, the top 10 prefectures account for 70 to 85% of the total cases over the nation. These Japanese maps show the geographical distributions of COVID-19 in each epidemic wave. The maps show that the different geographical distribution of COVID-19 cases. For more clearly understanding, we calculated the disease clustering of COVID-19 according to the epidemic wave. The term disease clustering is used if the frequency of disease is higher than normally expected for a specific time or area adjusted by the population size. The situation of infection in the neighboring area is also used for calculation. As a result, each epidemic wave holds a different location of disease clustering of COVID-19 cases. At the same calculations, lower columns show the disease clustering of deaths due to COVID-19. The maps also presented the different locations of disease clustering of COVID-19 deaths on each wave. In addition, even during the same epidemic wave, the location of disease clustering of cases and deaths do not always match. So as a second question, why is the distribution of COVID-19 cases and deaths are different depending on the location and the epidemic waves? For finding the answers for these two questions, I would like to discuss about the risk factors relating to infection and death of COVID-19 other than clinical factors, such as socioeconomic and environmental factors. This figure presents a racial risk. The forest plot of meta-analysis with over 1 million patients resulted Asian American has lower risk for infection, but higher risk for ICU admission and mortality than those of African American or Hispanic. This study shows the association of social vulnerability index, SVI, values with COVID-19 incidence and mortality rate. SVI is developed by CDC and is adjusted by poverty rate, unemployment rate, or per capita income and education level and so on. The result shows that the higher SVI score is increasing both incidence and mortality. This is a result of our study that evaluated the correlation between GNI and case fatality rate COVID-19 among top 100 countries. It resulted that the countries with higher GNI have lower fatality with a statistic significance. This is a comparison of case fatality among the income level. The result indicated that the fatality was higher in the countries with lower middle income level than those of the countries in higher upper middle income level and was approximately twice of high income level. Next, some slides are results from our study using the data in Japan. This is the result of the evaluation for the correlation between GDP and number of the cases and deaths and fatality rate of COVID-19. It resulted that the prefectures with higher GDP have lower number of cases and deaths. However, the fatality did not present the correlation. It may suggest that the healthcare system for treating COVID-19 patients of Japan work well, even in the low economic prefectures. These figures show that the correlation with aging rate. Aging rate means that the prevalence of population aged 65 years and higher among the total population. The number of cases and deaths are increasing according to the aging rate. However, the case fatality is not statistically correlated. The reason may be similar with the reason of GDP. Next variable is vitamin D. Several studies suggested an association between vitamin D and the outcome of COVID-19. Patients with low vitamin D levels present an increasing risk of severe pneumonia requiring admission to ICU or mortality. Also, the study suggested that the spatial distribution of vitamin D deficiency in tropical countries and sunny countries are rare. However, our studies resulted that the correlation between the number of sunny days per year and the number of cases and deaths and fatality of COVID-19 are not observed. So we changed the point of view to the annual temperature. It also has no correlation between the temperature and the number of cases and deaths and case fatality rate of COVID-19. The next is about the forest rate. The Food and Agriculture Organization of the United Nations, FAO, reported that the forest rate of land of Japan is 68.2%, while it accounts for about 30% of the world land. At the inside of Japan, if the forest rate is increasing, the number of cases and deaths are decreasing with a statistical significance. It may result from the location with high number of forest rate, has low population, and it means rural area. We found that the higher number of train stations are correlated with a higher numbers of cases and deaths. The case fatality rate is tended to correlated with the number of stations. The result suggested that the human movement is related to the COVID-19 case and deaths. At the final context, I would like to talk a little bit about prevention of infections. For establishing the infection, three major factors are needed. Among three factors, cut the route of transmission is the only factor that we can be reached easily by our decisions. Previous studies suggested that the face mask is the effective method for preventing SARS-CoV-2 virus in terms of receiving infection as well as letting infection to some other else. Social distancing also effective method to prevent infection, making 2-meter distance reduce the absolute risk to less than 1%. However, understanding of preventive behaviors for each individual is the key to prevent infection. Our research shows that the Japanese had a high original masking habit and hygiene behavior before the COVID-19 pandemic. So anyway, these are posters at time of the Spanish influenza in 1918. Mask, hand hygiene, gargle, and social distancing have been known and used as important prevention measures for infection from 100 years ago. In summary, besides the clinical factors, the socioeconomic and the social science factors, including economic level, age distribution, healthcare system, environmental factors, and human movement are important factors relating to infection and severity of COVID-19. Comprehensive perceptions are crucial for developing the countermeasures to COVID-19 and the further pandemic of emerging infectious disease. However, additional examination is needed for defining the principal factors influencing to infection and severity of COVID-19. So thank you very much.
Thank you very much for sharing your presentation with us on the different socioeconomic factors associated with the spread of COVID. I'm going to now invite Major General Banerjee to share his presentation with us. Major General, are you there?
We began this process of trying to understand the concept of security and how this gets affected by all sorts of varied factors some quarter century ago. Under a major project of the Ford Foundation, a Pan-Asian project, it was decided to examine all the various facets that bring together the possibilities of change in our security and strategic environment. And a major presentation, a Pan-Asian presentation, was organized at Singapore in late 2003, followed by a presentation at the UN headquarters in New York on the findings of this conference. And from then began this process of serious examination in Asia of the non-traditional security dimension of global security. And my congratulations and compliments to the RSIS and to the NTS for taking this process forward. We live in very challenging times right now. After 100 years of the Spanish flu, we were struck again by a global pandemic that totally transformed the way that we lead our lives, pursue our business, or engage in our livelihoods. Just a presentation by the International Panel for Climate Change, which was submitted to the United Nations Secretary General, that the world has perhaps just a decade before, irreversible climate change can put the global sustenance at risk. And the United Nations Secretary General has very strongly highlighted the challenges that lie ahead. And finally, I think we are reminded by the war in Ukraine that conventional conflicts with the possible use of weapons of mass destruction and its utterly devastating consequences for global sustenance is very much present with us today. These threats, which we thought has gone into history is alive and well. May I have the next slide, please? Yes. Now, very briefly, my presentation will be restricted to the planning and measures adopted by India. And I will focus essentially on these issues. And first, of course, is that India is very seriously affected by both the impact of global environmental degradation, the climate change, and the impact of public health issues that were symbolized by the pandemic. While India possesses an enormous capacity, both for research, production, development, and production of vaccines and other treatment measures for dealing with these pandemics, but the challenges are so huge, and Indian economy itself is in transition, that it presents us an enormous condition for much deeper and intense work. The impact of the climate change and on individual health is now there for all to see. Next. Next slide, please. Yeah. It is essential to be a little clear regarding both the planetary health and human health. Planetary health, of course, denotes the health of the world, of the earth, and its capability to sustain the living beings in this planet. And human health, of course, focuses on the individual well-being of persons and other living beings inhabiting this earth, whose existence and sustenance is dependent and linked closely to the planetary health condition. It is in that context I would like to highlight very briefly the concept from India of Vasudhaiva Kutumbakam, a Sanskrit word which symbolizes the ancient Indian thinking of the concept of the world as a single family. I had the occasion of mentioning this some years ago at a NTS conference in Singapore. This philosophy means that we are all in this together collectively, and it is our collective interests that have to be safeguarded by the world working together as a single family. It is not national interests and how I survive at the expense of another that will lead to an effective addressing of this problem at its global level. The collective addressing of these problems, which requires pooling of resources, pooling of knowledge, sharing it widely, and in that process, conferences such as this and the experiences of different parts of Asia become so vital. And so therefore, the world as one family must be the central theme of addressing these issues of planetary and public health measures. Next slide, please. India, of course, is deeply impacted by this. It is the fourth largest carbon emitter today by 2017 standards. But in per capita terms, it is among the lower carbon emitter countries. Carbon emission lasts for a long period of time. And so therefore, it's not just today's carbon emission, but what has been done a century ago, 2 centuries ago, and whose results continue to pervade this atmosphere, is what leads to the degradation of our planetary health. And this, of course, has historic connotations. The developing world may not necessarily be the principal responsible nations for today's climate problems. These have been really based on the industrialization of the developed world today, 100 and 200 years ago. And so therefore, you cannot either hold this nation or that nation responsible, but it has to be a collective responsibility of the planet to address together. Next slide, please. Once again, the Indian environment has been hugely impacted by recent developments, industrializations, and the consequences of economic development and modernization. But in spite of that, there are ancient problems that continue: air pollution, open defecation, and leading to malnutrition, and forest degradation, which have been going on now for quite a long time, has had an impact in today's environment. Next slide, please. Next, yeah. Now, environmental degradation in India has been caused by a number of factors, and these causes and reasons still continue. And the policy and the actions of the government are addressing each of these issues in a very substantive, coherent policy measures and actions at multiple levels of governance in a complex country like India. The problems are highlighted in these. These are, of course, common to many other nations as well. Next slide, please. Next slide. Yeah. Now, the Indian government has taken a number of measures in response to these challenges. And especially in the last decade or so, these have received enormous attention from the government, and detailed studies, plans, and policies have been set out for this. I've listed some of these policies, and these, as you can see, has been in the last decade or two, very comprehensive policies. But the challenges for nations like India, large countries, different, a wide range of variety in both in problems, population, people's needs, challenges, etc. The implementation of these require resources, require dedication, and require a deep governmental intervention in order to implement them correctly. These are on, and currently large number of measures are being focused on by the government of India to address these questions. Next slide, please. Human health and well-being are intimately linked to the state of the environment. And this particular slide, I hope you can see it, brings out the linkages between the various aspects of climate degradation and impacts on health. A cumulative impact of both these cannot be avoided, and hence both have to be tackled simultaneously in a very coherent and systematic manner. Next slide, please. Next slide, yes. Now, India also laid out a very elaborate national health policy just 3 years ago, 5 years ago. And in this, a whole question of how to promote, prevent climatic degradation, environmental degradation, and promote health for individuals were laid out in a very careful manner. These policies are in their initial stages of evaluation. More detailed studies will be required to find out the actual state of their implementations, the difficulties being faced at different stages under different conditions, and how they are to be improved and developed further. It is very much a work in progress. However, India is attempting to develop in a poor developing society, comparatively poor, substantially poor individually per capita income wise, how to enact an effective national health security scheme that will provide the needs of individual health requirements across the nation in the manner that many of the developed nations of the world have managed to achieve in the last few decades. It's a huge challenge, but the plan is currently being developed, and the implementation is likely to be given the highest priority at the national level. The pandemic brought out the enormous steps that required to be taken in order to overcome the many limitations in the provision of national health in India. Next slide, please. Next slide, yes. So these are the challenges that continue. Uh, Now, may I just highlight that conventional wars have now suddenly emerged once again as a major threat to international security, which in turn will impact on all other aspects of both global environment as well as public health. Uh, Globalization is now seeing has been has been provided a setback. To get back to collective international actions will become difficult. Conventional wars, if they continue as they are currently in Ukraine, in Europe, where it was expected that the conventional wars will not take place in future, and will not take place in the future. We are seeing that emerging in a very vicious manner, bringing back geopolitics into the equation, and which will then highlight national interests and national objectives rather than the international approaches to a comprehensive security and sustenance. Funding will be diverted, as it already has been very substantially in the case of Europe, for example. Defense expenditures in the NATO, which Donald Trump was extremely upset about, as to just being about 1% of GDPs, have been increased in the last year by twice the amount by some advanced countries, for example, like Germany. Chemical and biological weapons, which have been abolished by the world, has been banned in its use, and that includes the nuclear weapons as well, now are seeing a comeback. Greater focus, funds, resources, and technological support are likely to go into these areas unless we can once again eliminate the possibility of large-scale global conventional wars. One impact is, of course, the movement of people just in Europe will devastate the whole context in these situations in a very substantive way. And finally, if the conventional conflicts begin to dominate our agenda, dominate our media, and as well as public attention, are likely to be neglected. So this becomes conventional wars and conventional conflicts once again gets intertwined with the whole range of our environmental and planetary security as well as with public health. Uh, I do not want to continue in this. Next slide, please. Yes. Now, the way ahead is well known. We need to develop a greater global awareness, linking the various types of conflict with the environmental situation and the sustenance of the environment. Highlight the environmental consequence of a major war. I do not want to dwell on the impact of a possible nuclear exchange. That possibility, if it persists, can, of course, end the planet as we know it today. And therefore, the challenges of dealing with these complex issues, including that of large scale mass migrations, with all its different challenges, etc., have to be addressed simultaneously. Next. Next, please. Yes. In conclusion, all I would like to say is that time has come now for both the national and the international measures to come together in a collective endeavor at the planetary level with a great sense of urgency if we are to ensure that this generation leaves this planet in at least the same condition, if not better, than what we have inherited. I'm afraid the sustenance of the planet and the people that inhabit it will be in for a serious, challenging situation in the coming future. Thank you.
Thank you, Major General. May I now turn to Dr. Sufia, Senior Research Fellow at the Bangladesh Institute of International and Strategic Studies. Can you hear me?
Is my slide visible? Is my slide visible?
Yes,
Hello.
it is.
Yes. So, respected Professor Meli Cabello Anthony and Professor Tansri Dr. Jamila Mahmood, and the moderator of this session, Dr. Elster Cook, and learned panelists, and dear fellow audience, Assalamu alaikum and a very good morning from Bangladesh. So I'm very much delighted and honored to get the invitation to speak some words in this prestigious conference. Thank you so much to the organizers for inviting me. And today I am going to present a paper on the nexus between climate change and health from Bangladesh perspective. So this would be the outline of my presentation. So in the first section, I would like to discuss the planetary health in the Anthropocene. And the next section, I would like to discuss the direct and indirect health issues from the Bangladesh perspective due to this, this climate change and other planetary health crisis. And in the third section, I would like to focus on the gap between the climate condition and the public health policies. So the evolution of the planetary health concern, which has been discussed widely by Professor Dr. Jamila. So I will not very much elaborate in this section. I just want to mention that this emerging field actually is making stresses the deep interconnectedness between our nature and the human health, and the huge gap between that what we know and what we do, because the uncertain nature of this planetary health crisis, and which is very much unpredictable, and which is very much which is ever changing very quickly. So we really don't know that we really need to do more work on that, what we know and what to do to overcome this crisis. And regarding the planetary health in the Anthropocene, because this health crisis actually causing pragmatic changes and the times of uncertainty and unprecedented biophysical changes. So the notion of planetary boundaries are breached by the fossil fuel economy and energy consumption, population growth, technological development, land use, and land use cover change, as the professor mentioned earlier. And the profound environmental change related to this new era is not a topic for the future, but it's a present reality. And the key paradox that has been identified, some of the several scholars, that the key paradox which is facing by the humanity is following that the Western model rather than the indigenous way of curing our nature or the planet. And now I would like to focus on the Bangladesh perspective. So Bangladesh is located in the east of India on the Bay of Bengal and one of the largest delta in the world. And the country is known for its many waterways, including the world famous GBM basins. So due to its geographical position and the population density and the dependency over the natural resources for their livelihood, the country is very much vulnerable to the climate change impacts. So if you see this, if I very shortly summarize the vulnerability of Bangladesh regarding the climate change issue, the Global Climate Risk Index ranks Bangladesh as the world's 7th most affected country over the period of 1919 and 2018. So since 2000, the frequency of weather-related disaster has increased by 46%, and Bangladesh suffered the economic losses of 3.72 billion from 2000 to 2019, and 60% of worldwide deaths caused by the cyclones in the past 20 years occurred in Bangladesh. And as I will discuss some of the major challenges that Bangladesh is facing, very much related with the climate change issues. First, the sea level rise. So the rising seas are a growing threat to the people all around Bangladesh. That's because a staggering 2/3 of the country is less than 15 feet above the sea level. But sea level rise is not just a problem because of outright land loss, but it also a problem because of the salinization, the process of which salt infiltrates the agricultural land and hindering the crop growth by limiting their ability to take up the water. And then again, on the top of increasingly ruining crops, salinization threat the drinking water supplies of tens of millions of people in the coastal communities of Bangladesh, and consuming this salty contaminated water can is exposing the populations to the health problem like the cardiovascular diseases and several skin diseases. And the next major impacts like cyclone and storm surge due to the geographic location in the Bay of Bengal. So Bangladesh is very much prone to cyclone and storm surge, but due to the climate change, the intensity and the frequency of the cyclone and storm surge has been increased in these previous decades. So if you see the statistics, like Cyclone Sidor in 2007 struck the country's coast and claiming it has taken about 3,406 lives. And just 2 years later, in 2009, Cyclone Aila affected the millions of people, and it left around 200 million people homeless. And in 2016, Cyclone Ruano actually caused 2,026 fatalities. And 3 years later, in 2019, the cyclone Bulbul swept through the country and forcing over 2 million people into the cyclone shelters. So in 2020, the cyclone Amphan also took the lives of 10 people of Bangladesh and left thousands of people homeless, destroyed at least several thousand hectares of agricultural land in the 7 coastal districts of Bangladesh. And flooding and the unmanageable urbanization. You know, Bangladesh is very much flood-prone country because it's a riverine country, and it's a major delta, as I told earlier. So the climate change is making rainfall more erratic and often far more intense. So in Bangladesh, this reality rings especially true. This phenomenon of stronger downpours combined with the rising temperatures, melting the Himalayan glaciers that feed rivers around Bangladesh, is leaving massive swaths of the country far more prone to devastating floods. Increasingly supercharged water levels in the Ganges, Meghna and Brahmaputra river basins are destroying entirely the villages and hundreds, thousands of livelihood in the rural areas. And this devastation that contributes to more than 10 million people of Bangladeshis are already being converted as a climate refugees. So for this context, like if I took the context of Dhaka, Bangladesh's capital and the biggest city, Dhaka holds already 47,500 people per square kilometer, nearly twice the population density of the Manhattan. Yet nowadays, up to 400,000 low-income migrants arrive in Dhaka every year. So it's a huge pressure for the urban governance and the people who are connected with this to manage the city with this huge flow of environmental refugee or migrants towards Dhaka. This when these migrants actually move into the city, they don't find any any services or any facilities from the government, because the city is not prepared to receive this huge amount of migrants or refugees. So they're forced to settle into the densely populated urban slums with the rudimentary housing conditions, poor sanitation, and limited economic opportunities. So you can easily understand that what would be the health facilities that they can expect from this environment and from the existing health facilities in the city. And for this reason, actually, Bangladesh has been categorized as a very vulnerable country in terms of the climate change impact. And if you see, not only all over the world, but even in the South Asia, within the South Asia, the death attributed to the environmental risk, the Bangladesh is posing the highest number, highest position of death due to this environmental crisis. And if you see this graph, you will see that the mortality and disability due to this environmental risk in Bangladesh over time. And it is actually, although some of the positive policies, the number is decreasing, but still the number is very high if I compare to the other countries, as I shown in earlier slides. And it is actually creating huge pressure to the government of Bangladesh. One of the study found that there are about $3.72 billion has to be the Bangladesh government has to be invest like $3.72 billion for taking care of these losses due to this disaster and other impacts caused by the environmental change. And I would like to focus on the impact of climate change and on human health. My previous panelists also have discussed about the health impact due to the climate change. So I will not elaborate this figure. I will just focus on some of the key areas where actually we need to focus on, and which is very much relevant also the Bangladesh perspective. So the some of the direct impacts of the climate change includes that the outbreaks and the spread of the infectious disease, heat stress related the mortality from the extreme high temperatures, and the mortality and morbidity from the extreme weather events such as floods, storms, and cyclone. And the indirect effects are through its effect on the replication and spread of microbes and vectors. And sometimes when people actually forced to migrate and they have to engage themselves in the conflict, their mental, it affects actually their mental health. They feel stress and anxiety, and there are some of the times they also feel other mental disorder, which actually affects their family and the community life. And if I more concisely mention some of the vector-borne diseases for Dhaka, so respiratory illness are likely to increase with the rising temperature and the humidity. In the recent years, Dhaka is facing this type of respiratory diseases very much. And the waterborne diseases like cholera are likely to be decreased with the increasing humidity and temperature. So 1% increase in relative humidity reduces the probability of contracting waterborne illnesses by 1.6% percentage points, whereas 1 degree increase in mean temperature reduces the likelihood of the respiratory infections by 4.2 percentage of points. So you can easily assume that a very minimum percentage of humidity change, how much it affects on the human health. And the dengue is likely to increase for Dhaka because as the climate conditions become more suitable for the the reproduction of the dengue mosquitoes, humidity in the range of 60 to 80%, maximum temperature between 25 degree to 35 degree, and rainfall between 200 to 800 millimeter create ideal condition for the mosquitoes. And weather data between 1976 to 2019 indicate that Dhaka is experiencing the falling humidity level and rising temperatures and heavier summer rainfall. So these all together factor is like urbanization are increasing the risk of a spread of dengue in the Dhaka city. And as I told earlier, that the changes of weather can also cause the mood swing, but seasonality have a slightly different impact on the anxiety and the depression. And several studies have shown that the level of anxiety disorder increases with temperature and humidity as well. So, and more people suffer from the depression during winter, and increase in temperature lowers the probability of depression by 1.6%. So further, women are at the higher risk than the men for the depression, while men are for susceptible to anxiety due to their loss of their livelihood, and maybe sometimes they are forced to migrate. So as a head of the household, they have the more burden to take care of their families due to these cultural practices. Sorry. Slide has been shared. So why does climate justice is an urgent issue for Bangladesh? So if we ask this question and we're talking about the climate impacts in Bangladesh, it would hardly be complete without mention of the staggering injustice Bangladesh faces, because overwhelmingly climate impacts are being imposed on Bangladesh by the high emitting countries, mostly the developed countries. So as a country, Bangladesh emits only a tiny fraction of the greenhouse gas emission causing climate change. Perhaps more telling, the average person in Bangladesh emits 0.5 metric tons of carbon dioxide per year. In the US, for comparison, that number is 15.2 metric tons per person. So about 30 times as much. And there are some good policies at both the global and national level to manage the converging risk of the climate impacts. At the global level, we all know that the IPCC reports, which actually give the global citizen a glimpse of the current the condition of our planet, and the projection that can cause the impacts more severe in the coming years. And the Kyoto Protocol, which actually focuses on the reduction of the emission, and the clean development mechanism, the Cancun Agreement in 2010, and the Durban Agreement in 2011. So all of these policies and initiatives are taken at the global level, but at the national level, Bangladesh has also done a very good job of taking different policies to reduce the impact of the climate change. If I mention some of the initiative here, that the National Adaptation Program of Action in 2005, Bangladesh Climate Change Strategy Action Plan in 2019, Bangladesh Climate Change Fund, Bangladesh Climate Resilient Fund, Disaster Management Act in 2020, 2012, and Standing Order on Disaster, which these disaster-related policies actually reduces our death rate in terms of the frequency and the frequency of the disaster, because previously more people are died, but nowadays because of this strong disaster policies, the death rate has been reduced tremendously. And the National Plan for Disaster Management 2010 and 2015, Disaster Policy Act 2015, and most recently the Mujib Climate Prosperity Plan in 2020 to 2030. And if I add one point, that Bangladesh is has been nominated as a president of Climate Vulnerable Forum for next.
Sorry, Dr. Sufia, please can you wrap up in 1 minute?
Yes, sure. Thank you. So these are the challenges to actually implemented those policies. So at the global level, there is a justice and equity in the North-South relation and the political economy of the bargaining strategies and resources, and the lack of consistency over the strategies. And there is a gradual increase of sessions, subsessions, controversy over agenda settings, transparency, and the procedural disputes when the negotiation actually take place in the global forum. And at the national level, we have the lack of institutional capacity and resources, lack of coordination among the institutions, and of course the corruption and the uncertain and unpredictable, ever increasing nature of the climate event.
Thank you very much. I think we need to move into the question and answer session now, and we'll be able to pick up on some of these issues. And I think one of the issues that you mentioned there was the impact or the role of climate justice, which will perhaps have some responses from the other panelists, and we'll be able to hear how they consider this in the areas that they focused on, which I think we've heard from the experiences across the region on the stresses to planetary health in different ways. We've heard about the medical waste in Indonesia, to the non-medical perhaps, or the indirect health factors in the spread of COVID. But also then we heard from Major General Banerjee about the need to highlight environmental consequences of perhaps some of the more conventional war and security issues. So I'd like to now open up the floor to Q&A. So if anyone would like to ask a particular question, but for all the panelists, please keep in mind the one question that I posed there about what role does climate justice have, perhaps from your perspective, and also in terms of the second presentation, perhaps you'd like to reflect on the issue of medical waste and how that has affected Japan. Can I now invite any questions? Lena? Thank you.
Hi, good morning. I'm Lena from the NTS Center, RSIS. I have one question for Mr. Arisma. I remember before the outbreak of COVID-19, the Indonesian government already announced serious plans to deal with marine plastics. I would like to ask, where are we with regard to implementing those policies or plans? What's the impact of COVID-19 on these policy initiatives? And my second question is from Dr. Manabe. Just now you present very interesting research to look at the correlation between different factors with COVID-19 cases and deaths. I wonder, have you done any research on the correlation between social factors and the number of cases? Just now you mentioned environmental factors such as forest plant coverage rate, and also economic factors such as GDP. I wonder, what I mean by social factor is for example, the number of NGOs or the activism of social groups, these kind of dynamics. I wonder whether such research has been done in your research, or have you come across in your broader literature review? Thank you.
Before I turn to the panelists, let me just ask if there are any other questions at this time. Yeah, Anita?
Yeah, my name is Aninda. I'm from ICS Yusof Ishak Institute. I'd like to ask a question to Mr. Arisman as well. So first of all, thank you for pointing out the problems of waste management as well as the river pollution in Indonesia, which is very important. And I think it is the climate and humanitarian hotspot that overlaps, as mentioned by Professor Jamila just now. So my question is that who actually has the authority to govern medical waste in Indonesia or maybe in the region? Because I think this is not only Indonesian problem, but also global or maybe regional problem. Who has the authority to govern waste and the management of waste of medical waste? Yeah. So and the second question is that, as we might know, that river pollution also caused by the people habit in throwing waste into the river, not only the medical waste. So I'm just wondering how many % of the medical waste that is thrown into the river as compared to those household waste that is thrown by the people? Because you mentioned about hotels, about hospitals. That is, do they really throw their waste to the river, or do they have other kind of methods to process it? And any collaborative efforts among stakeholders to push these behavioral changes that we can learn from Indonesia? And the second question is to Dr. Sofia Khanum. You mentioned about the challenge to implement the environmental agreement treaties in Bangladesh. I wonder how politics, other than institutions, influence the climate-induced disaster in Bangladesh. Is there anything that you can share with us? Thank you so much, El.
Thank you. Okay, so I will go through the panelists in the order in which they spoke for the first round. So Mr. Arisman.
Yeah, thank you, Alistair. Yeah, I would like to start for the first question from Lina. Yeah, as we know that Indonesia government have several policy related to how to reduce marine plastic pollution under the Coordinating Ministry of Maritime Affairs as a leading ministry, and of course coordination with other ministry. And Indonesia also already established a National Plastic Action Partnership. It's a national multi-stakeholders platform to tackle plastic pollution from the river going to the ocean. But since a pandemic, the challenge is especially from the society or household, that when they order online food, shopping online, this is also increasing of the plastic packaging in the delivery order. So as well as the increasing of, I mentioned PPE, personal protection equipment like face shield and mask. This is also another issue. So yeah, the challenge of COVID-19 in the other side, government would like to reduce plastic pollution, but plastic is also a protector. So this is can be a polluter or protector, is become a dilemma for Indonesian government. So now in the local government also try to ban the plastic, but still again during COVID it's not easy because related to health issues. For the second question from ASEAS Singapore, who is the authority of medical waste? Of course, the regulation coming out from the Ministry of Environment, coordination with the Ministry of Health. But this is again, the coordination issue is become a serious issue also in Indonesia in terms of the policy and then the implementation, because who is the monitoring? Who is monitor if someone try to not follow, not following the rules. Yeah, this is one of the issue of monitoring for the people who not follow the regulation on the hazardous and toxic waste, which is including the impact of COVID-19. And then the second question about how many % people throw away the medical waste to the river based on the finding from Indonesian Institute of Science. I already mentioned in my presentation that there's increasing of the this medical waste, especially for the PPE and face mask, which is not like from the medical equipment, but some of the river they found there's also medical equipment, but this is of course illegal. I mean, they throw away maybe in the mid of night. Yeah, I mean, not a legal way. So this is one of the issue because also already announced by media now, but this has become an issue of our pollution in the river. So yeah, it's very complex issues, and I think that's from my response. Thank you.
Thank you. Can I now ask Dr. Toshi, please? You're on mute.
Thank you very much for the question for our research.
Again, we saw a sell-off for tech stocks. You can see the NASDAQ index, which is tech weighted, down over 2%. The S&P 500 also.
Dr. Toshi, can you try
yes,
again?
Yes.
We can hear you.
Okay. Our corrective study is on the process. Has not completed yet. So we have a plan to take the additional issues and the variables for our analysis, including social factors. So only difficulty is we are using the data from the openly available, and also we collected data with a questionnaire survey. So at this moment, sometimes it's difficult to take those kind of data from regarding the social factor, including the indicator is very critical for analyzing. So, we are planning to do it anyway. So, and then for work and collected all of the data which we can think, then to think the principal factors to correlate it to the case and death of COVID-19.
Thank you. Major General Banerjee.
Well, Alistair, there was no specific question towards me, so I would like to skip this point.
I had one.
Skip this round. Okay, yes, please.
One. It was over what is the role of climate justice, and to paraphrase, you said that there was no single country is responsible, and we need a collective effort. So I'm just wondering, in the concept that you explained to us, whether there is a role for climate justice in that.
Well, yes, indeed. Well, of course, now, anything of this nature becomes a much more complex issue requiring international cooperation, as we have seen even in conventional conflict. Now, all these issues are coming to the fore, and we are seeing a return more to nationalism rather than collective action. And I'm afraid this is likely to impact on climate policies as well. As we see, the funding from international sources for climate action where required to particular targeted nations, etc., is likely to now sharply decline. And in those conditions, how we can build and develop collective action for addressing planetary situations will remain a challenge. Even in the case of India, a large nation which is a federal country, implementation mechanisms are at the provincial level. And so therefore, at the national level, what is quite often done is to lay out the broad policies, allot resources, provide guidelines, carry out a certain amount of coordination. But the implementation remains at the provincial level. And that level of complication is multiplied, actually, when it comes to the international level. That is why I think we need to even more consciously build up the concept of collective global action, especially when it comes to planetary health. This was, of course, the lament that the United Nations Secretary General was mentioning regarding the IPCC report. And of course, he goes on to accuse the heads of state around the world of being neglectful regarding such cooperative endeavors. That is all I think I can vouch or suggest at this stage for this issue.
Thank you. That's great. Dr. Sufia, I'm wondering if you could give us just a short answer here around the success that you've seen with regards to climate justice in Bangladesh. Perhaps you have an example you could share with us?
Yes, thank you for the question. I would like to focus regarding the climate justice, as Major General Dipankar has already mentioned, that it is when the climate negotiation came, actually the national issue get the priority, then the collective issue. But for the planetary health, we must actually work together. So there is a specific question regarding the climate refugees from one of the students, that at the national level, actually climate refugees are a very huge concern for Bangladesh, because the land is very much limited for Bangladesh, and due to the sea level rise, the land mass will decrease over the years. So, and there is no international law actually that we can actually define them, or we can actually told them as environmental refugees. So, and our cities are actually not prepared. And then again, the coastal areas where the most vulnerable people are living. So actually from the government level, there is no very much initiative so that they can sustain there and they can run their livelihood from the coastal areas. So at the international level, from the justice perspective, that the most of the vulnerable countries, the climate vulnerable countries, are the developing countries. So there is a political economy of the bargaining strategies and the resources. The people, the representative from the vulnerable countries have the limited resources to actually bargain in the negotiation table, and they don't have the access of this expert, or hire the people, those who can set the strategies for the negotiation table. So it's from the political perspective, they are actually in the I can say in the weak position for the negotiation. And then again, there is the fragmented leadership in terms of injustice, in the climate injustice, because the leaders are actually fragmented into different groups. So there is a coordinated effort is not much observed. And from the climate justice perspective, Bangladesh, as a president of the Climate Vulnerable Forum, Bangladesh is trying to actually focusing on the nationally determinant contributors, NDC in short. So they're trying to actually motivate the other countries to prepare this report according to the Paris Agreement. So hopefully before the next conference, or the next conference organized by the UNFCCC, most of the vulnerable countries can prepare their NDC report, and then can focus on the climate justice to the in front of the in the world community.
Great, thank you. I'm just going to ask if there are any last questions from the audience. We have one. Can we have a short question, please?
Thank you, Dr. Alistair. Very short. Climate justice. This is a function. It cannot be imposed upon. And everybody is talking about the ownership behavioral change. So when we are talking of these segregating the waste to get rid of the plastics, it's really driven by the inner switch, inner pull rather than the push. Do you think this is okay?
Is that directed at a particular panelist? Would anyone like to respond? Yep, sure. Dr. Jamila.
Actually, that's a really important question because in Asia, particularly, the whole issue around waste management and recycling, the systems are not in place. I can speak on, from our experience as well in Malaysia. But I'll tell you what has worked. It's driving the private sector private-public partnership. So I'll give you an example that we have a recycling program in Petaling Jaya, which is quite a large suburb, where Nestle and Tetra Pak, because of the they have something called a they have to make sure it's not single use. Okay, so they partnered with the city council. And what it happens is that you have to do a lot of engagement with the community, and you tell them, just put your waste and we will collect. As a result of that, Nestle and Tetra Pak obviously take the ones that need to be recycled. For the city, the incentive is that there's less going to the landfill. So there are 180 tons lorries less in a span of 1 year. So the cost to the city is reduced. So there's incentive. So what I'm trying to drive is, how do you incentivize recycling and waste management for, number one, the state, the city council, number two, the public, because what the public finds is that there's less, it's brought to composting. They can actually commercially produce the compost. It can come back to the community. So you have to design this such that there's and I think the only way is private-public partnership to bring that behavioral change eventually through incentives that everyone feels the incentive, right?
Thank you, Al. Maybe I should just say a bit to sort of round up this segment of the conference. What Dr. Jamila Mahmood says is a very important illustration of what is needed going forward with regard to whether it's climate justice or planetary health. It's important for us to perhaps think about, a more segmented response to the issues of environment degradation and partnership. Big companies, they are all ready to do something, because at the end of the day, it makes sense and it's good for their profit margin. And the more they endear themselves to socially conscious consumer, the better it is for the future of the respective companies. But then they are also confronted by a big challenge, which is how to go across big territory, big state, big country. So going forward, we should actually try to start to think about maybe working or focusing our responses in dealing with planetary health on a more city basis. Working from a city, Dr. Jamila talked about Ipoh, which is a very interesting small city in Malaysia. Yeah, there is a certain cultural pride in the well-being of the city. And similarly, in Bangladesh or in India or in Indonesia, there are various cities, each of them having their own cultural traditions, which will motivate people to think about working as a city first before going on to the bigger national level or provincial level. So it's something that our speakers on this panel may want to think about. Yeah, and for us in the audience, we should also try to focus on what is doable quickly. Because if we keep on talking and there is limited result from all our discussion, the morale of our citizens will be more and more reduced, And I think there is tremendous scope for us to start working from the respective township or the country, city that we are located in. And then with that, some demonstration projects can be supported by the big companies. Don't just depend on government. It's not going to work very fast. Thank you.
Thank you very much. So that leaves me now to close the session and thank the individual panelists. So if you could join with me in thanking the panelists for their presentation.